everyone. Welcome to Peripheral Nerve Ultrasound Case Diaries. Today we are going to discuss a case of penetrating nerve injury. A 20-year-old male presented with history of penetrating injury to right forearm on his flexor aspect by glass about 1.5 months back. He underwent wound suturing for that at Peripheral Health Center. However, afterwards he developed median claw hand since then. And these are the ultrasound images. This is the clip. We can see the median nerve. We are tracing from proximal to distal, and what we can see is a well-defined hypoechoic swelling at one of the ends of the nerve. Now we are not able to trace the median nerve any further. Again, there is another hypoechoic swelling, and distal to it, the median nerve looks pretty normal. We have reached almost slightly proximal to the carpal tunnel level. This is another video clip taken in the sagittal section. We can see this is the median nerve. This is the median nerve. There is a bulbous swelling at its end. This segment of the median nerve cannot be seen, cannot be traced, and again there is another hypoechoic nerve swelling, and proximal to it the median nerve looks pretty normal. So these are the static images. What we can see, this is the median nerve in the proximal forearm. This is the proximal segment of the median nerve, and we can see a well-defined hypoechoic swelling or hypoechoic mass at the end of the nerve. This is consistent with the neuroma formation. And again, this is the distal nerve segment, and we can again see another neuroma formation. The nerve distal to it looks normal in morphology and echo pattern. This is a panoramic ultrasound image, and see how nicely we can depict the entire extent of this peripheral nerve injury. This is the proximal segment of the median nerve. The nerve looks pretty normal. In echo texture, we can see this is the echo pattern, the normal polyfascicular echo pattern with a well-defined hypoechoic swelling, that is neuroma formation at the proximal cut end, and this is the distal nerve segment with neuroma formation at the distal cut end. And also we can nicely depict the gap between the two cut ends, which comes out to be approximately 3 centimeters. So with the help of ultrasound, high resolution ultrasound, and with this nice panoramic imaging, we can map the entire extent of this peripheral nerve injury. In case of nerve transaction, we can exactly demarcate where the nerve is transected, what is the distance between the two cut ends, is there any neuroma formation at the cut ends, and all this information is very important from the management point of view. If this patient is going to be taken for surgery, then this ultrasound image provides the complete roadmap for surgery. So the diagnosis is complete transection of median nerve in the mid forearm with formation of neuromas at proximal and distal cut end.